Hi, everyone. Welcome to Dream Journal's Bedside Stories. I'm Samuel Kim with Dream Journal 501(c)(3. We're an educational nonprofit dedicated to helping all health interested students engage with evidence-based medicine at a meaningful level. The Bedside Stories podcast specifically is to demonstrate how physicians see evidence as a compassionate tool for patients rather than just as a channel of innovation. There's no better person to speak on this than Dr. Khagi this month. We are discussing breakthroughs in oncology, and Dr. Khagi is not only an exceptional scientist, he's also an innovator. He's the current medical director of neuro-oncology at Hoag Family Cancer Institute, and he's also triple board certified and the founder of several startups that he himself has ideated. So he is an incredible man. One of the greatest stories he's ever told me, and I think really show what kind of physician he is he was the first man to run with Optune in a marathon, and he did that to demonstrate his compassion for his patients and how research really impacts patients at a personal level. So thank you so much for being here. How are you today?
Yeah, good. Thanks, Sam, for having me.
Of course, thank you. Our first topic here is really broad, but I thought you of all people should speak on this. And if anyone kind of interacts with our content, they should hear this from you. But we're kind of going to talk about maybe your best lessons for pre-medical students. So people are thinking about getting to medicine, things that they should think about. You're obviously a monument in your field. What are key drivers for your motivation day to day if you're a pre-medical student, even now as a faculty member?
Yeah, pre-medical students, they're going through already quite a bit and planning out their path in college and making plans for medical school. I think it's important for people to make decisions with perspective and making sure that they acquire that perspective from various sources. And that comes in the form of speaking with physicians and other people in the healthcare field, understanding what motivated them and how that aligns with their own personal motivations. When I was, considering medical school, it was actually when I was in high school, obviously, because I went to the University of Missouri in Kansas City. The accelerated combined program was the BAMD program. I kind of had to do a lot of that already before, making a decision about whether or not I was going to I was going to go into medicine. And the way I did that is I, proactively connected with various physicians in different fields, surgery, emergency medicine, primary care. I wanted to get a sense of what it was like. What is the day-to-day like of being, what is it like to be a physician? The common theme that, as I recollect, was that you have to know that you will be working hard for a very, very long time. You will be dedicating your life to the lives of other people and to improving those lives through science and medicine. Um, and that really resonates with me because I was very good at science. I really loved biology, chemistry, physics, the anatomy, cell, how the cell works. All of that really was very much in the direction I wanted to go in. But I also enjoy speaking with people, getting to know them. You know, I wasn't particularly social in high school, nor I think I was that social in medical school. But when it came to patients and seeing patients suffering or in need of something, um, I, it really drew me in because I felt like I could help those people with what I know, with my knowledge. And as I continued to acquire that knowledge, that became very evident that the more you know, the more you can help, right? So that's I think an important point. This has to become part of you. And when you're an undergrad and you're in pre-med, you have to understand this becomes you. I think people are now looking at being in medicine as a job. It is not a job. You cannot go into medicine and look at it as a job because you will be miserable. Okay. People are, your patients are very needy. Their families can be very demanding. And if you look at this as something that where you just punch in and punch out, um, you're going to be disappointing yourself and you're going to be disappointing your patients. It doesn't mean that you have to kill yourself to do this job, but you also have to have the perspective that it is more than just a job. It is a calling. It is very, very much a calling. All right, so I'll leave it at that. I don't want to dominate this conversation with like all these views, but I think when you're about to go into medicine, you're thinking about medical school, get perspective, talk to people, and you'll realize very quickly that these people are dedicated to what they do, somewhat to a detriment and to their health.
Thank you so much for saying that. I have heard this before from you, but every time I hear it, it's not only riveting, it's just a reminder. I think it's almost like an emotional speech, and so I really thank you. For pre-medical students out there who say like I haven't gotten to that step where I feel that way yet. Um, in addition to perspective and finding a mentor, what kind of discussions should they have? Like, how should they approach the discussions? What's like the single like best piece of advice you could give them when approaching the introspective and perspective building part of their learning?
Yeah, I mean, you have to sort of at least have an understanding as to why you're going to do what you're going to do, right? But what are your goals? What do you want to accomplish? Financial security should not necessarily be the primary reason why you go into medicine, because you'll figure out, depending on what kind of work you do, is that you're replaceable. You really are replaceable. Um, Most people don't really figure that out until quite late in their career, but in many respects, you're a resource to, the healthcare system that you work for, even the patients that you might see. I mean, if they don't like your services, they're going to find somebody else. They're going to replace you. You have to love what you do to a point where the joy that you get every day is justification for why you come into work. Okay. It may not be the joy that you get like when you get married or you have your first kid or you you do your first Ironman race, whatever it might be. It's not that, but there has to be sort of that baseline level of joy that you come into work and you have a purpose. Okay. Purpose. That is really, really important because when it comes to medicine and when you have people's lives in your hands, you have to understand your role and your purpose. Okay. That's sort of I would say that's the baseline of where I think people's minds should be when they're considering this job. What is your purpose? And is this how you define your purpose? You don't necessarily need to know what field of medicine you're going to go into as an undergrad. You shouldn't. All right. And if you do, you're probably going to change your mind. I'm like, 90% sure that you're going to probably change your mind because you're going to be exposed to so much, okay, later on. Just understand that you're going to a field that is very, very purpose driven. It should be purpose driven. You are part of a group of very, very, I don't want to use the word elite because I don't know, I don't want to come off that way, but people that like work their asses off and delay gratification, put themselves into debt willingly, right? Willingly put themselves into debt and deferred a lot of sort of happiness, to do this job. In order to I think to be happy doing this job, you have to understand that this was all worth it and that you have purpose and you have a drive. Um, I would say that, if you are able to look at yourself as an undergrad and say, I feel like this will give me purpose in my life. This will this will define my life in the way that like when at the end of my life, at the end of my career, whatever it might be, I can look back on it and say, this was worth it. Then I think that's the reason to pursue medicine.
I think now more than ever, especially with all the, not to get political, but with all the things going on in our government, I think remembering what you said about just physicians working their asses off for almost no reason but just to help is an important reminder. And also just the fact that you model that every day, I think is heartwarming for a lot of us who feel abandoned this time. So thank you so much.
Yeah,
Um,
and I don't, whatever the political climate is, it's really interesting because medicine, it needs to rise above. It doesn't matter who's in the executive branch or who's being elected to whatever office. You rise above that because no matter who, that say that patient's political views on things, it doesn't matter. They're still a human being. Okay. What you do transcends all of this pettiness. It just goes beyond that. what you do, what you understand, the mechanisms of how the cell functions, of how drugs work, how they're developed, and the reasons for why they're being developed, and you as a clinician, how you're using, surgical techniques to stop a bleed or to remove an appendix or to do a cardiac bypass. That goes beyond what we see in social media, in the news, just in general, what people talk about these days and what they're worried about. You know, people will always need doctors. People will always need to be cared for, no matter no matter what's going on in politics. That's what makes me feel good. That's when the world seems heavy, I go back to the root the reason of why I do what I do. And that, again, that brings me joy and I'm happy. I go to work happy. I don't think about what's happening, because what I care about is that next person in front of me, that next patient that needs my help. That's my purpose. And that's my joy.
Thank you so much. It's really amazing to hear. Uh, Kind of the next topic actually has a lot to do with what you were just saying about patient experiences and specifically how research fits into the patient experience.
Mhm.
Um, and all this discussion about patients sort of being a highlight in your day, are there any stories that kind of show how research can elevate rather than de-escalate the patient interaction for you?
Oh, absolutely. Absolutely. I think that's an important distinction, because I had personal experience with this, where people are just so smart, can be incredibly detached because they are so in they're so consumed by the science of what they do, which is, that might bring them joy. That might make them happy. But what I love about what I do and how I do it is that I feel like I blend, what you would describe as humanism and a love for humanity and a desire to help and improve outcomes and the health of your fellow human. But I realized in order to do that, it doesn't just take what I know, but it's also this need to continue to educate myself, to continue to learn new things, and to continue to occasionally push the boundaries of what we're able to do. And that's where science comes in, right? I do something, my field is oncology, and specifically within neuro-oncology. What I do is something that I describe as almost like frontier medicine. Not like I'm on the frontier, like in the wilderness doing medicine. It's what I would describe it as sort of you're at the edge of where we are in our knowledge and how we address problems. Because we get to a point where it's sort of an evidence-free zone. There's a boundary where you have evidence to support your decisions, and now you've got less or no evidence to support your decisions. And that's sort of that gray area that I occasionally operate in after things sort of fail and things aren't working, for a patient's brain cancer, for example. And that's why I love my field because it allows you to be creative. It allows me to dive into the literature to understand mechanisms of what's going on, to see if there are drugs available that hit those particular pathways, or perhaps repurpose drugs to hit those particular pathways based on preclinical evidence and animal models and cell lines. But it also allows me to either develop my own ideas in the context of a clinical trial or work with scientific partners, either within, academia or within industry to bring those new concepts, new ways of treating disease into the clinic and open up those opportunities for my patients. That's exciting. That is the frontier. That is sort of us pushing the boundary of science and of medicine and humanism to bring more options to patients that would otherwise have no hope, okay? That they would have no other opportunities to treat their disease and to potentially live longer and better lives. That is how we meld humanism and science, okay? The whole reason why we do science is to help other humans, right? That is the reason, that is the rationale, that is what I do. And I can't, for me, I can't extricate that from one another. I can't remove these two elements. They are always blended in my mind. This is why I do what I do. If I was a scientist in a laboratory, then, and I've worked with people like that who are absolutely brilliant people, but they have absolutely no idea, like, what this is actually going to do for people. They know what this is going to do in a mouse, but what this is going to do for a human being, it's very abstract for them. For me, it is not abstract. It is very real. And that reality is very closely blended with the science, you know. So that's, I mean, that was a long-winded answer for how humanism actually drives science, for people like myself.
Yeah, absolutely. I think that was one of unimaginably well said, and I think it's really important to note that, especially as researchers, we have experienced both probably the little bit of the harsher, more logical side of science, but also like the deeper, more compassionate side of research. And from what I know about your work, and all of our listeners who do review what you have done, and it's all online and it's incredible, I'm sure they can tell that what you're saying is truly from a deep and lifelong experience, this like experiences that you've had. Kind of talking about like the frontiers of medicine, this idea that there are borders between evidence and no evidence when the therapies have failed. When patients come up to you and they're in these positions or they're asking for medicines that may not be standard of care, what is sort of your approach with the patient in discussing the best therapies for them?
I think it's very important to listen to people and to not discount, their ideas on medicine. Many people, and I've experienced this more recently than ever in the past 5 years, are very distrustful of pharma, of the sort of scientific establishment, even of me, that I'm somehow being paid, to do this. And that's hard because they are being very skeptical, and that's okay. I recognize that. It's actually important to acknowledge that skepticism because, I mean, we see, we hear about in the media a lot of the bad things that happen either within clinical trials or pharma, or pharma bros sort of running amok of drug prices and screwing people over. You see that, and I honestly I think it's ridiculous not to acknowledge that and not to validate a patient's sort of mindset that, like maybe people aren't really looking out for their best interest. But I think as, when you sit down one-on-one with a patient and their family, it's very important to convey, and again, that goes back to the humanism, your personal humanity, and that the reason why you're doing what you're doing, the reason why you spent literal decades trying, like learning and understanding to get to this point, it is not to enrich yourself, but rather to enrich their lives, to enrich society in such a way that you are benefiting their health, helping them live longer and more productive lives. That is conveyed in not as many words, but it needs to be conveyed during that visit to align, to make sure that your goals for them are aligned with their goals for themselves. Okay, which is to live good and productive lives and to really focus on quality of life and not just quantity of life. I think if you do that, people will listen and they'll have a more open mindset about what is available, what is sort of things that aren't particularly effective. I get a lot of questions about, various other alternative therapies, and and that's fine. You just have to use your knowledge to say, like, there may be perhaps some evidence why mushrooms could work in your disease. And they have been studies for various properties, but you're coming to me to get a view of things from an evidence-based perspective that that and I explained to them that we understand these mechanisms because and how we prescribe drugs based on studies that allow us to define the dose, the frequency of administration, how we measure, the blood to make sure that these levels are therapeutic, and then also judging response. And that takes years to understand. And to watch a YouTube channel on some of this is just, I think it's important to acknowledge that because people want ownership. They want to own their, what's in front of them and be in control of their health. And I want to empower people to do that. But there's a lot of bad information out there that people will actually listen to and that they're going to hurt themselves by listening to those things. I think if you take sort of a perspective of that, you acknowledge what I just said, you want people to take ownership of their healthcare, but it needs to be done as a partnership between myself, my knowledge, their goals, and what they want to achieve, and also being able to listen and discuss. And I feel like I've done that pretty well with a lot of my patients. I'm very willing to listen and let people talk about their ideas and things like that. And I'm also, and they when they see me listening to them, they listen to what I have to say, right? Because I mean, the expert in the room is really me, but I don't want, you got to make sure as a future physician, Sam, as a future physician, that you don't necessarily need to come off as the expert. You are. You have nothing to prove. You've got the MD behind your name, right? And they know that. Okay. Most people just want to be heard and acknowledged. I think that's really, really important. I think a lot of physicians don't do that well. And I think that's where a lot of the friction happens. When you hear them out, when you talk to them, when you when you give them your advice after hearing what they have to say, I think it's better received in my mind.
I think the phrase like you have nothing to prove is so powerful. I think a lot of providers walk into the room and feel like they have to just prove how smart they are. But like you're saying, you have nothing to prove, and listening is probably the greatest gift and the most generous way you can be there for the
Right.
patient. So
They already know you're a doctor.
yeah.
It's okay. You don't need to flash anything. Like it just take the time to listen, all right, and make eye contact. Good God, just look at your patient. Look away from the screen, look away from like the keyboard where you're typing, just look at the patient and let them say what they need to say. It will go such a long way in building rapport and building trust and them actually listening to your advice. Okay, they may not take your advice, that's fine. These are adults, all right. But at least you build trust between you as a representative of the, I don't know, medical industrial complex, whatever these people may think you are representing, but at least you are still a human being and you're able to listen. Okay. So that's key, I feel like.
Thank you so much. That's all the questions we had. And I know you're very busy, so I don't want to cut it too short, but I kind of wanted to go through maybe the key points what we talked about. If anything to add at the end, you can add it, and if not, just thank you for being here. But I think we sort of discussed, like, talked about when thinking about becoming a medical student and going into medicine, you should not number one, prioritize discovery, finding new perspectives and mentors, but two, trying to find your purpose, answering your why, and realizing that every day should be a joy as a physician going to see patients.
Yeah.
Um, Two, sort of like how research fits into the patient experience. You discussed the humanism part of science, and I think wonderfully, you sort of coined this idea that there's frontiers in medicine, these gray lines between evidence and no evidence. And in those difficult discussions, the main thing you should always remember is to listen, to look away from your screen, to look at the patient, not try to prove anything, but to see exactly where they're coming from and form a partnership. So,
That's exactly right. That summarizes everything perfectly. So I think as long as your listeners are, if they're medical students or rather pre-meds that are contemplating a life in this field, it's exactly what you said. It's finding your purpose, knowing why you're doing what you're doing, not necessarily what you're going to do, but why you're going to do it, right? That is the most important thing because that is what's going to keep you engaged, keep you happy, and to minimize episodes of burnout. And I say episodes because I have been burnt out. I feel like I have a lot of purpose in my life. I feel very um, lucky to do what I do, to be trusted as much as I am trusted by my patients and their families. But I have my points where I feel absolutely worn down. And part of that is also just, personal life and family and just the responsibilities of life. But what brings me back from those moments, okay, is sort of like thinking about why I'm doing what I'm doing. And that helps. Okay. It's okay to be burned out. It's really important that your listeners hear this. You will be burned out. Okay. At some point in your career, either in pre-med or in medical school, or if you're taking a gap year, or when you're a resident, a fellow, and then when you're finally an attending, you will have periods of absolute exhaustion, and it will manifest as burnout where nothing will really make you happy at that moment. Okay. But just like getting an upper respiratory infection from a virus or a cold, you heal, you get better, things turn around, and you remember what it felt like before you got that virus, right? You're able to breathe through your nose. You'll get that back, right? You'll get that sense back. And, it's just important not to forget it, right? It's important not to forget it that, things will get better. And if you're consistently burnt out and you've, your reasons for doing what you're doing are no longer aligned with what you thought it was going to be like, then I think it's important to reevaluate things. Take some time for yourself, reevaluate it. Maybe you'll come back to it. Maybe you won't, and that's okay too. All right. But I think to go through your academic career, your training, which will be decades, and all the delayed gratification that you're going to experience, right? And all those life events that your non-medical friends go through and you aren't really part of as much, is it's hard not to be a little burnt out. Um, so that's why it's important to have that purpose, to define that purpose early on.
Um, I think those are probably the most important words anyone's going to hear. So thank you so much
Yeah,
for that.
yeah, of course.
Thank you for your time.
Yeah, thanks a lot, Sam. Thanks for having me, and best of luck to you guys.